Hello friends, this is Dr. Srinivas Mavva. I'm a cardiologist. Today's issue is, if I have strong risk factors for heart attack, how can I reduce the risk for a heart attack? Suppose I have diabetes, suppose I am smoking, suppose I have high BP, suppose I have strong family history of heart attacks. These are the four major risk factors, what we call. In case I have these things, there is a high chance that I could be having heart attack down the line, 10 years, 15 years down the line. What should I do to reduce the risk? First, risk factors are risk factors. They increase your risk. They will not cause the disease. So, the risk factors, we can stop the risk factors at causing the risk itself. They need not transform to a disease. So, the mediating factor between a risk factor and a disease is bad cholesterol, LDL. So, we need to specifically monitor this fasting lipid profile to look for LDL. LDL has to be less than 70 in case you have a major risk factor. So, take a tablet. I'll tell you how to reduce it. But basically, monitor LDL, always maintain it less than 70. You can monitor it every 3 months or at best at every 6 months, preferably 3 months if you have risk factor for heart attack, and keep it less than 70. How to keep it less than 70 is by dietary modifications, by regular exercise, and taking a tablet to reduce the cholesterol. There is no shame in taking a tablet, because what we want is reduction of LDL by whatever means. The diet and exercise helps, but the actual reduction is not caused by them. It takes a lot of effort to reduce LDL with exercise alone. So kindly take a tablet, preferably lifelong, so that it's like a health insurance policy. When you take a tablet, you can rest assured that the LDL is going to come down and your risk comes down. So take a tablet, combine that with a dietary modification and exercise. Exercise is extremely important because it decreases the triglycerides, which can later transform into LDL. So there are triglycerides which are basically can reform LDL. They are extremely sensitive to exercise. Maybe within 2 to 3 days with regular good exercise, it can come down. So exercise is extremely important. Decreasing carbohydrates in your diet is important. The third factor is tablets. These three combined can decrease your LDL, decrease your risk to cause a heart attack. So you can, even if you have any risk for a heart attack, by following these methods, following these suggestions, you can escape from heart attack. But I did not include smoking here. That is because smoking has to be stopped at all counts, basically. Smoking immediately has to be stopped because smoking doesn't increase through LDL. Smoking directly increases the blood clotting and also causes the blood vessels to contract. So you may do all these things, but if you still smoke, you may tell that I exercise regularly, I have a very good body, but still if you smoke, you are increasing your risk for a heart attack. This is the main cause for people having heart attacks in the gyms. People think I am doing 2 hours of gym, I am very fit, but so I have the divine right to smoke. It is not so. So you have to immediately stop smoking, then adopt the measures I told you. Then even if you have strong risk factors for heart attacks, basically, you can stay away from heart attacks all your life. You can have a full, healthy, happy life. Thank you.